You know, knee pain has a way of turning these simplest pleasures, like a walk in the park, into a pretty big challenge. But what if you could actually fight back? Well, we're about to break down some simple, proven strategies from Dr. Sumaya's NutriCare Clinic that can help you get moving again with a whole lot less pain.
So, here's our game plan. First, we're going to dig into why knees hurt in the first place. Then, we'll get into some powerful lifestyle tweaks, unlock the secrets of an anti-inflammatory diet, go over some simple pain relief tricks, and finally, we'll touch on some medical options you can talk about with your doctor.
All right, first things first, we have to get to the bottom of why those knees are aching. I mean, you can't really fight an enemy if you don't know what it is, right? So let's start there.
This is the big one, isn't it? Is knee pain just something we have to put up with as we get older? Well, the answer is a little more complex than that, and honestly, a lot more hopeful. Let's break down the usual suspects. So here's the thing. Knee pain isn't just one thing. It could be osteoarthritis, which is kind of like the tread on your car tires wearing down over many years. Or it might be rheumatoid arthritis, where your own immune system gets confused and starts attacking your joints. Then you've got bursitis. That's when the little fluid-filled cushions in your knee get all inflamed. And sometimes it's just the ghost of an old injury from years ago making a comeback. Figuring out which one you're dealing with is a huge first step.
Okay, so now that we have an idea of what we're up against, let's talk about your secret weapons, your everyday habits. These are the foundational, really powerful steps you can start taking today for stronger, happier knees.
Okay, get ready for this number, because it's a big one. For every single pound of extra weight you're carrying, your knees feel 4 pounds of extra pressure every time you take a step. That's just wild, right? It also means that losing even 5 or 10 pounds can feel like taking a 20 or 40-pound backpack off your knees. It's a huge deal. Now let's talk about a total game changer that's literally right at your feet, your shoes. Think of them as shock absorbers for your entire body. Good arch support keeps everything aligned, and cushioned soles just soak up the impact from the ground. So yeah, it might be time to sideline those stilettos or those super flat shoes. Your knees will seriously thank you for it. And listen, I want to be crystal clear about this. Using a cane or brace isn't about giving up. It's about gearing up. It's a smart move. A cane, used on the opposite side of your sore knee, can take a huge load off. A brace can give you that extra stability and confidence to move. It's all about finding the right tool to keep you in the game.
All right, time to head into the kitchen. Because believe it or not, what you put on your plate can either fuel the fire of inflammation or help put it out. We're going to talk about building an anti-inflammatory kitchen.
Think of these foods as your body's own personal fire department. The omega-3s you get in fatty fish like salmon and mackerel, they are incredible at calming down inflammation. Try to aim for a couple of servings a week. Then, pile on the nuts and seeds, add a whole rainbow of colorful fruits and veggies, and you've got yourself a delicious defense strategy.
And hey, you can't have healthy joints without a strong foundation, and that means strong bones. Just think of calcium as the bricks, and vitamin D as the mortar that holds it all together. You really need both working as a team to keep your bone structure solid. So, you can literally eat your way to healthier knee cushions. That's what cartilage is. Vitamin C is absolutely crucial for making collagen, which is the springy stuff in your cartilage. Foods like garlic and onions provide other key building blocks, and something like bone broth is a fantastic source of collagen itself.
Okay, but what about right now, when the pain is flaring up and you just need some relief? Let's go over a few simple, at-home therapies you can use to soothe that pain and stiffness.
The age-old question. Heat or ice? Here's the simple way to remember it. Heat is for stiffness. Think of it like a warm hug for your muscles. It gets the blood flowing and loosens everything up, especially before you get moving. Cold is your best friend for swelling and acute pain, usually after an activity. It calms everything down and helps numb the area. For both, just remember the 15 to 20-minute rule. And we can't forget about nature's medicine cabinet. Turmeric and ginger are absolute rock stars when it comes to fighting inflammation, and they're so easy to add to your cooking. A little eucalyptus oil rubbed on the knee can also feel incredibly soothing. Now, these are great options, but you know the drill. It's always smart to run them by your doctor first. So, what if you're doing the lifestyle things, you're eating right, but you still need some extra help? Don't worry, that's totally normal. There are more tools in the toolbox. Let's look at some medical and supplement options that can provide that next level of support. You've no doubt seen glucosamine and chondroitin on the pharmacy shelves. They're basically the raw materials your cartilage is made of. Now, the research on them is a little mixed, but many people find they really help. Omega-3s, on the other hand, are a slam dunk for inflammation. As with any supplement, it's a great idea to have a chat with your doctor to see if they're a good fit for you.
This is a pretty cool option, especially for osteoarthritis. Think of it as an oil change for your knee joint. As we age, that natural, slippery joint fluid can decrease. These injections basically add that lubrication back in, which helps the joint glide smoothly and can reduce pain for several months at a time.
Just a quick but really important note on over-the-counter pain relievers like ibuprofen. They can be a lifesaver on a particularly bad day, for sure, but they really aren't meant for long-term, daily use without a doctor's supervision. The golden rule is simple. Use the lowest dose that works for the shortest time possible.
And that really brings us to the main takeaway of all of this. There is no single magic bullet for knee pain. The key is to find what works for you. It's about building your own personal toolkit, combining a little bit of diet, a little bit of lifestyle, and maybe some therapies to create a plan that fits your life. So as we wrap up, I want to leave you with a question. You don't have to overhaul your entire life tomorrow. Just pick one thing, one small, manageable step. Maybe it's swapping your soda for water. Maybe it's digging out those supportive walking shoes. What's the one small step you're going to take for your knees today?